Now, I am a pediatrician belonging to the so-called modern medicine. But I tell you that homeopathy works. Have that confidence. Even if you want to use allopathic drug, first think, is it really necessary? And still if you feel, then take the opinion of someone who knows about these things. But homeopathy works. Finally, by managing the child properly, you will even get more adult patients. And for that, your clinic should be baby friendly. What I do when the child comes with the family, my stethoscope is hidden here, behind the table. You know, this is the table, family is sitting there, child is there or playing around, and my stethoscope is hidden. So the child is not scared, but there are toys all around. There's a horsey there. Some people call me horse doctor. There are other toys around. And I ask the family to just leave the child alone. But the important thing is, the moment the child enters the clinic, your clinic, baby-friendly clinic, you have also started thinking, what is the problem? You don't touch the child, you don't examine the child, but you are watching the child move around. To give you an example, you know about ADHD, Attention Deficit Hyperactivity Disorder, and you know about autism, right? Now, when the child comes inside, can you guess, is it ADHD or autism? Speak loudly so that they can also hear. Child just walks in. You may be wrong in the long run, but at least your mind starts working in that direction. A child with ADHD versus a child with autism. Little louder, huh? So what will you notice difference between these two? Loud, huh? He is not listening. The one with ADHD will be hyperactive as the Attention Deficit Hyperactivity Disorder. So he will be jumping from here, there, you know, right? Playing with this toy, that toy, you know, not sitting at one place. He may start playing with one and then he shifts to another. And what about the one with autism? Loud. Here you are, this child, you know, the one with ADHD, he comes in, he looks at you, and then he says, seems to be reasonably all right guy, and starts moving about, start playing. But the one with autism is not looking at you. He just is in his own world. He will go and maybe start playing with something in the corner, busy with that. And no eye contact, as you very rightly said, you know. So you can straight away start thinking what's happening, you know, and leave the child alone. Don't be rushed to examine the child straight away. All right? Okay. One of the most important equipment in your baby-friendly clinic is toys, a weighing scale, a proper weighing scale. Because the weight of the child over the months or over the years, if the child is still following with you, is very important. How the child is growing, how the child is getting better or worse. So a proper weighing scale is very important. So toys, weighing scale, and a good torch. Why I said a good torch, I remember once a child had a head injury and was brought to me. The child looked absolutely all right, no vomiting, no unconsciousness, playing about, running about. And in any head injury, you want to examine the pupils, you know, for any abnormality of the central nervous system. So I saw everything okay, fine. But I called the child again for a follow-up because the head injury symptoms might appear a little later. Next time I find that this child had a cataract in the eye. First time I did not. Why? My battery was down. The battery of the torch was down and I missed it. Thank God for that I called the child for a follow-up, and here the child had congenital cataract. Nothing to do with head injury. Child was born with that. People had missed it. So did Dr. Anand on the first visit. But I was lucky, now I had a proper torch. So how important it is, weighing scale, torch, toys all around. But above all the time, a smile, compassion, love, beaming through you, warmth, beaming through you. Family feels so happy to have come to a place where they feel comfortable, where they're confident their child will be looked after well. He's not a commercial guy who is going to exploit them. He will give them the right advice. She will be concerned about my child as much as I am concerned with my child. Right? Also, supposing the baby is in the arm, small baby. Ask them to hold the baby like that. As you are talking, you can observe the child. You know? So the child focuses, and the child is now 2 months old. And you talk to the child, and child gives a smile. You say developmentally normal. But the child is now 3 months. The child doesn't respond to you. You know? You try to give a smile, no response from the child, no social smile. Yeah, you see what we talked was about general management of pediatric cases. And we said the main thing is that let the family feel confident when they come to you. And for that, there should be a smile on your face. Not very serious, high-flown, very big doctor, you know. And also have toys all around. A good weighing scale is important to watch the growth of the child. And a good torch is important. You may not use it, but when you use it, should be a good torch, and I gave some examples of that. And I said as soon as the child enters, you don't start talking to the child, examining the child, just observe the child. Let the child be around, play with the toys. And you may notice certain things without touching the child, because the moment the child is scared, the child starts crying, you may miss something, you know. So let the child feel free and walk around in the clinic, play with the toys, etc. And if it's a baby, then the baby is in the mother's arm and you are watching the baby responses, you know, while you are talking to the family. If it's a toddler, of course, who is running about, you will allow him or her to play around with the toys. If it's a teenager, treat with great respect. Let the teenager get a proper chair, you know, as any adult should, you know. Again, at your eye-to-eye contact level, you know, that's important. And then you can tell the father or the mother, tell me about the child. Don't say what's wrong with the child. Tell me about the child. Just an open-ended question, what we say. You know? Tell me about the child. You know? And then just listen. And this is very important that you listen more than what you speak.